Welcome to the deep dive. Today, we're looking at something that, well, it might sound pretty simple on the surface, cattle fractures. But trust us, it's way more than just a broken bone. This is really a deep dive into animal welfare, herd productivity, and some honestly quite surprising veterinary science. Our mission today is to unpack this whole intricate world of orthopedic injuries in cattle. We're going to try and distill the key info from our sources, helping you grasp the really diverse causes, the advanced ways vets figure these out, the different treatment options, and some, really innovative prevention strategies that are starting to reshape things. And you'll discover how basically everything, from what a cow eats every day to its actual genetics, plays a crucial role. Okay, so let's jump right in. Let's talk about the why. Why did these injuries happen? We'll start with the most immediate causes, traumatic factors. Think direct physical trauma. A big one can be injuries during calving, right? Especially if maybe improper pulling techniques are used if it's a difficult birth.
Oh, definitely. Dystocia-related injuries are, a major concern.
And young calves, they're so vulnerable, they can easily get stepped on by their mothers or other cows in the herd. And that risk goes up if the herd gets agitated, maybe by predators or even farm dogs.
Right.
And sadly, collisions with farm machinery, like, a calf getting run over by a four-wheeler, that's a real danger, our sources mention.
Yeah, unfortunately it happens.
For adult cattle, things like slipping, falling, even mounting during breeding can lead to serious stifle issues. That's like their knee and hip problems, often fractures.
Those falls on concrete or wet surfaces are particularly bad.
And then there are muscular ruptures. These are like sudden events. Sometimes people mistake them for fractures. They come from direct trauma or just extreme effort, especially if an animal's down and desperately trying to get up.
That exertion can be immense.
Now, here's where it gets, I think, really interesting, because the causes aren't always that obvious. Beyond the direct hits, there's this surprising category, iatrogenic trauma.
Yeah, meaning injuries caused by, us, by procedures.
Exactly. Caused by veterinary procedures. Our sources talk about pharyngeal, that's the throat area, and mouth injuries. These can happen from incorrect use of tools like a balling gun or a drenched syringe, for giving oral meds.
Or a probang, for clearing blockages.
Right. And if these aren't used carefully, it can lead to really severe swelling, something called diffuse cellulitis, which is widespread infection.
And feet getting stuck, trouble breathing.
Dyspnea, difficulty breathing. It's just a stark reminder that even when you're trying to help, you've got to be so meticulous.
Absolutely. Technique is everything there.
And beyond that, environmental and management factors, they play a huge role too. Think about housing. Cows in freestall or tie stall dairies, these common setups, they're actually more prone to hock and knee injuries.
Yeah, from that constant rubbing on hard or abrasive surfaces.
Exactly. And often it's made worse by just, suboptimal stall design.
Yeah.
Hard bases, not enough bedding, the wrong kind of bedding. Maybe the stalls are just the wrong size.
All those little details matter.
Even just wet lying surfaces can soften up a cow's claws.
Makes them way more susceptible to lesions, bacterial infections.
Definitely. And keeping barns free of stones, gravel, that's crucial for hooves. Regular cleaning, too, because the urea in urine can actually soften the claw horn.
Makes it more fragile, yeah.
Plus, overcrowding, high stocking densities, that just increases the chance of traumatic injuries and helps disease spread.
More contact, more stress.
And obviously, dirty environments, contaminated equipment, they can introduce bacteria through wounds, leading to abscesses, which just pull the animal's health down.
Which brings us to another really fascinating area, I think. How nutritional deficiencies and metabolic disorders act as these sort of silent contributors.
Right. The less obvious stuff again.
Exactly. They weaken the bone itself, or they make the animals more likely to fall or get injured in the first place. It's not always that sudden impact. Sometimes the body's own system is setting it up for failure.
So what kind of things are we talking about here?
We'll take mineral deficiencies. Calcium and phosphorus, they're fundamental, right, for bone strength. If there's a prolonged deficiency, you get conditions like rickets in young animals' weak, soft bones.
Okay.
And osteomalacia in adults, where the bones actually demineralize.
Yeah.
And the ratio between calcium and phosphorus, that's incredibly important too.
Got it.
But it's not just those big ones. Even trace elements matter hugely, like manganese essential for skeletal development. A deficiency can cause dwarfism, joint problems, weaker bones in calves.
Wow, such a small thing. Big impact.
It's like a tiny cog, right? If it's missing, the whole system can break down. Magnesium deficiency, known as grass tetany, is another one.
I've heard of that.
Yeah, it causes excitability, muscle twitches, staggering, convulsions, paralysis even. That dramatically increases the risk of fractures from falls.
Makes sense.
And too much sulfur, that can cause DL, polyencephalomalacia. It's a brain disease blindness, staggering, seizures again, high fall risk.
Okay, so minerals are huge.
What else? Well, vitamin deficiencies play a role too. Vitamin A can affect vision, skeletal formation. Vitamin D is linked back to rickets and osteomalacia.
Right.
Then you have metabolic disorders, milk fever, hypocalcemia, very common in dairy cows around calving time.
Yeah.
It causes this sudden paralysis. They go down, can't get up, makes them super prone to getting injured.
Because they're just stuck there.
Exactly. And similarly, pregnancy toxemia, later in pregnancy, leads to depression, lethargy. They can't stand.
Yeah.
Again, highly susceptible to injury.
So their own metabolism is working against them.
In a way, yes. And even what they eat can be toxic. Certain plants can cause neurological issues, muscle weakness, just general problems leading to weakness, incoordination, falling.
Like oxalates or nitrates.
Exactly. Or mycotoxins. These are toxins from fungi in feed. They can cause all sorts of problems: liver damage, kidney damage, neurological signs, weakness, all increasing injury risk.
It's a minefield.
It really can be. And finally, just having other concurrent diseases makes animals more susceptible.
Like
lameness, obviously. Hoof problems cause pain, change how they walk, increases fall risk.
Yeah.
Muscular weakness, ruptures, an inability to stand.
Yeah.
Septicemia, that's severe blood infection, especially in newborn calves, causes profound weakness, depression, makes them incredibly vulnerable.
Yeah, those poor calves.
Even bovine respiratory disease, BRD. It leads to depression, weakness, increases fall risk.
So this raises a really important point, doesn't it?
I think so. The core insight here, really, is that these fractures are rarely just one single thing. They're often the endpoint, the culmination of multiple factors interacting.
Perfect storm sometimes.
Exactly. This whole web of influences, which is why a holistic approach is just so vital. You address one risk factor, maybe nutrition, and it can have positive ripple effects everywhere else.
Yeah, it makes so much sense. Okay, so we've unpacked all these causes, the obvious and the more subtle ones. The next big challenge is actually finding the fracture, right? Diagnosing it accurately. How do vets do that? It really starts with a thorough clinical assessment.
Boots on the ground, eyes on the animal.
Exactly. It begins with visual observation. You're looking for lameness. That's the #1 sign, by far. Altered walking, weird posture, how they're holding their weight. Any, abnormal limb angles or clear deformities. Sometimes it's just reluctance to stand, or maybe they're vocalizing in pain.
Right.
Then comes palpation, carefully feeling the area. You can often feel tenderness, swelling, and maybe crepitation.
Like grating feeling.
Yeah, that distinct grating or crackling when broken bone ends rub together. And it's absolutely critical to check the foot thoroughly to rule out hoof problems. Using hoof testers helps pinpoint pain there.
And a critical point here, something producers sometimes miss, is that cattle are incredibly stoic.
Ah, right. They hide pain well.
Extremely well. They're masters at masking pain.
Yeah.
So lameness might be quite severe before it's even obvious to an observer.
That's such an important point, and it really highlights why diagnostic imaging becomes, indispensable.
Yeah, you need to see inside.
Radiography x-rays, that's the main tool for diagnosing fractures, but also for seeing dislocations, septic arthritis, joint infections, osteochondrosis.
Gives you that clear bone picture.
Exactly, cross-sectional images. Then there's ultrasonography. That's invaluable for the soft tissues, tendons, muscles, ligaments.
And fluid, right? Abscesses, foreign bodies.
Yep. And for the really tricky cases, you've got the advanced stuff. CT scans, computed tomography, and MRI, magnetic resonance imaging.
Incredible detail.
Phenomenal detail, 3D images. Super useful for complex areas like the skull or lower limbs. Though, the size of the machine limits things a bit in large animals.
Sure. Often just for specific parts or smaller animals.
But they're absolutely key for pinpointing deep infections sometimes.
So if we connect this to the bigger picture, it's pretty clear that just one method, like just an X-ray, often isn't enough, isn't it?
No, rarely.
Especially in complex cases.
Yeah.
You really need to integrate the different tools, the clinical exam, the imaging, sometimes lab tests too, to get that full picture. Understand the injury and any underlying issues.
So what this all really means is that the complexity here demands this multi-pronged diagnostic approach. It's not just spotting the break, it's figuring out if there are other systemic things contributing or even mimicking a fracture.
Precisely.
Okay, so once you have that diagnosis, what happens next? What are the treatment paths? Often the first step is conservative management, right?
Yeah, the less invasive route first if possible.
So that usually means rest and confinement.
Mm.
Stall rest, basically, to limit movement, let the bone heal.
hmm
Splinting and casting are pretty common, especially for lower leg fractures in young calves.
Because they heal so darn fast.
Amazingly fast. And effectively, too, even if the alignment isn't, perfectly textbook.
Functional healing is often the goal there.
Exactly. And supportive care is key, clean, dry place, removing anything that caused the issue, like bad bedding, and using NSAIDs, those anti-inflammatories, for pain and swelling.
Basic but crucial steps.
But for more complex fractures, or if conservative just isn't cutting it, then you move to surgical interventions.
Right, getting hands-on.
There are different ways to reduce the fracture, meaning line the bones up. Closed reduction is where they don't have to cut the skin open, maybe for simpler breaks, versus open reduction, where they do need to make an incision to see the bone directly, often for fractures involving joints or where the ends are way out of line.
Got it.
And then fixation methods, how you hold it together. Internal fixation uses plates, screws, maybe pins or nails inside the body.
Portability.
Right. Gets precise alignment and stability, often means you don't need a cast afterwards. Then there's external fixation pins going through the bone connected to a frame outside the
You
leg.
can see that more with really smashed up fractures, right?
Comminuted ones.
Exactly. Severely comminuted fractures or open fractures with lots of tissue damage. And there are specific surgeries, too, like draining those throat abscesses, the retropharyngeal ones we mentioned. That needs real care to avoid hitting nerves or major blood vessels.
Delicate work.
Definitely. And beyond the surgery itself, supportive care and adjunctive therapies are vital for recovery.
Can't forget those. Pain management, of course. Fluid therapy if they're dehydrated or electrolytes are off. Nutritional support, making sure they get enough calories to heal. Sometimes even tube feeding if they can't eat. Antibiotics, antimicrobial therapy for open fractures or infections like septicemia, and then specific treatments for those underlying conditions we talked about, like for salt poisoning, mycotoxins, vitamin deficiencies, pregnancy, toxemia, tackling the root cause.
So this brings up a really important question, especially in, food animal medicine. What's the prognosis? And how do you make the decision to treat?
The practicalities.
Exactly. A lot influences the outcome.
Yeah.
Fracture location is huge.
Yeah.
Higher up the leg, much harder to stabilize, generally a poorer prognosis.
Makes sense.
Skin integrity, too. Open fractures, where the skin's broken, have a much higher risk of infection, like osteomyelitis, bone infection. Lower success rate there.
Right.
Age matters a lot, too. Young calves, like we said, heal way faster than older animals.
So in food animals, it's a tough calculation, isn't it?
It really is. You're balancing the treatment costs, which can be significant, against the odds of success.
Yeah.
And the animal's actual economic value, or maybe its genetic value to the herd.
Yeah.
And like we touched on, the goal is often functional healing, getting them mobile, getting them to market weight. Not necessarily that perfect X-ray ready alignment you demand in, say, a racehorse or a pet.
That's a key distinction.
Absolutely.
Yeah.
And you have to consider potential complications too. Infection, the bone not healing properly, delayed union or non-union, or healing crooked malunion, plus secondary problems like laminitis in the hooves or issues with the other legs taking too much strain.
So looking at this whole picture, here's where things get really interesting again. How veterinary medicine is evolving, the emerging therapies.
Yeah, the cutting edge.
One super exciting area is regenerative medicine, using biology to help regenerate tissue.
Like stem cell therapy.
Exactly. Mesenchymal stem cells, MSCs. These cells are amazing. They can replicate themselves. They can turn into different cell types like bone or cartilage.
And they release helpful stuff, right? Growth factors.
Yeah, growth factors, anti-inflammatory proteins, all promoting healing. Now, it's maybe more common currently in pets for arthritis or fractures, but the potential for cattle is definitely there. They usually get the cells from the animal's own fat or bone marrow, which cuts down rejection risk.
Interesting. What else in regenerative?
Platelet-rich plasma, or PRP. This is basically taking the animal's own blood, concentrating the platelets and those crucial growth factors.
Okay.
And that plasma concentrate stimulates cells to grow, helps new blood vessels form angiogenesis, and cuts down inflammation.
Sounds promising. Maybe less complex than stem cells.
Generally, yeah. Often less expensive, maybe lower risk because it's just processed blood. Still needs more research for some applications, but definitely part of the toolkit now.
These technologies, they really do represent a potentially huge shift in how we approach healing, don't they?
Totally transformative.
But, and this is a big but, we have to acknowledge the hurdles in getting them from the lab bench to the actual farm.
Ah, the practical challenges.
Yeah. Regulatory bodies, like the FDA in the U.S., often see these therapies, and especially gene-edited animals, as new animal drugs. That means a really long, really expensive approval process.
Right. And in Europe?
Similar story, different regulations. The EU tends to classify gene-edited organisms as GMOs under very strict rules. It creates this sort of translational gap where the science is way ahead of the practical approved application.
That's a crucial point about getting these innovations out there, which brings us neatly to another revolutionary technology, gene editing, specifically CRISPR-Cas9.
The gene scissors.
Basically, yeah. This incredible tool lets scientists make super precise changes to DNA, add things, remove things, alter specific genes with amazing accuracy.
And the potential in livestock is just, wow.
It really is. We're talking about maybe creating animals resistant to major diseases. Imagine cattle naturally resistant to TB or BSE mad cow disease.
That would be huge.
Huge. Or enhancing growth, productivity, maybe improving milk quality, like hypoallergenic milk, and improving animal welfare directly. For instance, introducing the POLD gene, the one for hornlessness.
So no need for dehorning.
Exactly. Eliminating a painful procedure right at the genetic level.
Amazing potential.
So, okay, beyond fixing fractures and these cutting-edge therapies, how do we just stop them from happening so much in the first place? Prevention.
The Holy Grail, really.
It starts with the basics, environmental management and infrastructure improvements. Good housing, good flooring. That means deep, non-abrasive bedding, keeping it free of stones and gravel.
Clean and dry.
Regular cleaning to stop that claw horn softening, and just secure footing everywhere they walk. Super important.
Absolutely critical.
Then safe handling practices and equipment, not just less stress, but also using proper sterile technique for injections prevents abscesses. And being careful with drenching, giving oral meds.
Right, that head restraint, careful insertion, making sure they swallow, prevents those throat injuries we talked about.
Exactly, and avoiding really dry, coarse feeds or thorny plants that can damage the mouth lining.
You know, what really stands out across all the sources here is that constant refrain. Proper technique, cleanliness.
Yeah, it comes up again and again.
It does, and it just highlights that so many injuries, so many complications are actually preventable. It comes down to human practices, attention to detail. It's a powerful reminder of our impact.
It really is. Then comprehensive nutritional programs, absolutely fundamental.
Can't overstate nutrition.
Balanced minerals and vitamins, calcium, phosphorus, vitamin D, magnesium, manganese, all those trace elements too. Zinc, selenium, iodine, B vitamins, vitamin K, essential for strong bones, good immunity, overall health.
What's the building blocks?
Totally. And feed quality and management. Regularly testing forage, making diet changes gradually, preventing mold and mycotoxins through good harvest and storage.
And keeping an eye out for poisonous plants in pasture or feed.
Definitely. And water quality and access. Seems obvious, but continuous access to clean, fresh water. Screening water sources for high salt, nitrates, sulfates.
And that careful reintroduction after deprivation, crucial for preventing salt poisoning.
Yep.
The sheer breadth of nutritional prevention. It just shows how deeply it's tied into everything else. Farming practices, environmental care. It's not just the feed bunk. It's the whole system supporting that animal's health.
Well said. Okay, then herd health and disease control. Preventing those metabolic diseases like milk fever and pregnancy toxemia by keeping cows in the right body condition, especially late in pregnancy.
Managing body condition scores.
And for infectious diseases, good biosecurity, proper naval care for newborns to prevent navel ill, and really meticulous colostrum management.
Ah, yes, the 5 Qs.
Exactly. Our sources highlighted the 5 Qs. Quantity, quality, quickly, squeaky clean, and quantify. Making sure calves get enough high-quality colostrum, fast, clean, and checking it worked.
Sets them up for life, really. Strong passive immunity.
It does. Plus, obviously, tailored vaccination programs.
You know, this really underscores that shift, doesn't it? From just reacting and treating to proactively preventing disease systemically, building a resilient herd right from birth, making them less vulnerable overall.
Absolutely. And finally, genetics. Genetic selection and breeding considerations.
Looking further ahead.
Yeah. Selecting for polled cattle, the hornless ones, is a straightforward way to avoid dehorning pain.
Welfare win right there.
And then gene editing, CRISPR again, That huge potential to create animals inherently resistant to major diseases, which in turn reduces weakness, reduces falls, reduces fractures.
And enhance other welfare traits, too, potentially.
Exactly, built right into their genes.
It really feels like a paradigm shift, doesn't it? Towards breeding for resilience, not just treating disease after it happens, using genetics to reduce susceptibility in the first place. It's a powerful, sustainable approach for the future.
So as we kind of wrap up this deep dive, it's just abundantly clear, isn't it? Managing cattle fractures isn't just about sticking a bone back together.
Not at all.
It's about this deep, interconnected understanding of animal health, their environment, their food, even their DNA. The complexity is really incredible.
It is. And the solutions are just as multifaceted.
Mm-hmm.
And the future looks equally complex, but exciting too. We're seeing constant improvements in diagnostics, surgical techniques getting more refined, that growing promise of regenerative medicine,
Yeah.
and the truly transformative potential of gene editing. It all points towards more holistic, more data-driven, definitely more proactive ways to manage herd health, focusing on prevention, on resilience.
So, given how much all these factors impact animal welfare and, the sustainability of agriculture, how might really prioritizing these comprehensive preventative strategies fundamentally reshape the future of livestock management? And maybe what might that mean for our relationship with the animals we raise?
Hmm, that's a great question to ponder.
Something to think about. Thank you for joining us for this deep dive.